A peptide is a signal your body uses to trigger specific functions, repair tissue, release hormones, reduce inflammation. But that signal needs a healthy environment to work. When the body is inflamed, when the gut health is compromised, when the internal balance is off, the signal gets blocked before it even reaches its target. So when someone tells us a peptide or a treatment didn't work for them, the treatment usually wasn't the problem. Today, we map the full sequence and show you exactly where each therapy belongs. So welcome to another episode of the RESPIRA Series. My name is Dr. Carlos Torres. I'm a specialist in otolaryngology, sleep medicine, and obesity medicine. And today I'm here again with Dr. Diego Rutenberg, a specialist in functional medicine. And together we are working on a RESPIRA program, which is a wellness program based on 4 pillars of sleep optimization, nasal breathing optimization, proper nutrition, and supplementation. In our other episodes, Diego, we have spoken about 3 of the main elements already. The last one that we haven't talked about yet is supplementation. Talk to me a little bit more about supplementation. In a previous episode, you spoke about how you use supplementation, but there's so many options these days, you know, from herbal products to independent individual factors, you know, such as magnesium and vitamin C and everything, you know, that you can take individually. And now we have peptides and hormones that are used, you know. So what are the use of all of these, and what is the importance of each one of them? What is the role of each one of them, in your opinion?
You know, in my trained in the Oriental Medicine licensure that I took many years ago, as an herbalist, we were taught that herbs are drugs, meaning that they're powerful and they carry a punch.
Well, most medications are derived from
What I mean is
plants.
that when you are introduced to these formulations, it is a very complex science.
Yeah.
It's an art also. And but the first thing that they give you is a warning. It's like, hey, you can cure with herbs, but you don't use them loosely. You know? But they are very powerful. What I mean is that herbology and, in this case, nutraceuticals are so powerful that you can really influence people's health with them.
Yeah.
With that concept, what we visualize for our program is that we can establish a progression of how you incorporate the sequence of the supplements, because the progression matters in the way that you want to affect, and you want to modify the condition.
I see it like somebody that is trying to grow a avocado tree. You know, you cannot plant the seed in a soil that doesn't have any nutrients, and it's in a soil that is not in the right conditions, you know, to allow that seed to become a plant from their tree and then give you fruits. And the body is the same way. You know, we first have to set a base, you know, a very solid base where the other treatments that we're going to offer then moving forward in order to optimize functions, you know, have the ability to be more effective.
You know, I visualize almost like if I'm given a land and I have to start to cultivate that land. You know, the first thing that I'm going to do is I might analyze the soil, or I might try to restore the soil, so everything can grow, you know, well.
And one of the things when you do a soil analysis, one of the things that you look at is the pH.
Exactly. Yeah. And you do a pH analysis, and then you try to restore. And sometimes you have to detoxify or restore nutrients in the soil.
Yep.
So I guess that our first step when it comes to supplement optimization and supplementation is that, you know, so there's a sequence. Of course, at the end of the sequence, you can use higher or more sophisticated levels of supplementation.
Exactly.
So how do you see it from your perspective?
The same way. I mean, I think, but I mean, I go from, you know, from the back going, you know, from posterior to anterior.
Yeah.
It's you know, I most of the medications that I use in my practice are medications to treat problems that already have arisen. You know, I see this class of medications, of supplements, you know, as a way of helping prevent diseases that lead to the use of those type of medications, right? And I think that there's a use for all of them. Now, you know, granted that there are, you know, we can get supplements these days from everywhere, and the quality is questionable, you know. So, you know, working with in the right program that really guides you, what are the supplements that you really need, what are quality supplements, you know, where to get them from, and all that, you know, is extremely important. But these are the transition, you know, from herbal products that help establish a very solid base. I think it's something very important that is going to allow that other treatments that help optimize body functions and maybe prevent getting to those chronic disease stages, you know, and that help optimize function in general, you know, allow those type of supplements to work even better than you know, in people that are not optimized first.
Yeah, I think that in most cases, and we can agree on that, there is going to be a progression when we utilize the herbal supplements and upgrading to more possibly treating digestive compounds that are going to improve digestion, absorption, digestive function in general. And even you can, through that, you can increase neurotransmitter activity, you can increase hormonal signaling, stimulating the digestive system. Of course, we always talk about the pH. What other products you have in mind, or what other supplements you have in mind?
No, so other than the herbal products, you know, I think that we are moving in the direction where other products like the peptides, you know, become very important.
Which are a revolution in medicine right now.
And they are. The most important thing again is that right now everybody wants to get access to peptides, but the quality of those peptides and where you're getting them from, you know, it's like a gold rush right now. What's happening, and everybody wants to get into it. And I'm always a little bit cautious when that is happening. You know, so the most important thing, and what we're trying to establish in our program, is that if somebody is trying to move into that direction, you know, that we offer them the right quality of peptides, but also at the right time. And that is something that is extremely important. But I see a lot of potential because these are supplements and products that are basically improving functions that in our body already are happening. And that over time and with age, we start losing.
Yeah, that's the idea of the supplements in our program, that they are introduced in a progressive way, always listening to the patient. So it's not a dogmatic approach. It's mostly an individualized approach to every person's needs.
Absolutely. Well, this has been a fascinating topic as well. I think with those 4 pillars, we're very excited to introduce our program, our RESPIRA program. We call it RESPIRA because RESPIRA it's Spanish for breathing, okay? And breathing certainly is one of the main pillars, but it's also when you breathe properly, it gives you a sense of wellness, which at the end of the day is what we're trying to achieve and give our patients, you know.
I love that name.
Open the door for a life of wellness. And these 4 pillars, sleep, nutrition, breathing, and supplementation, can definitely help us get to that goal.
That's the idea.
Well, thank you, Diego, for this conversation.
Thank you.
And until the next one.
Yes.